Hello, everybody. Welcome back into Talking Fitchburg. Joining me today from Fitch-Rona EMS, Deputy Chief Jeff Dostalek. Jeff, welcome back to the show. How you doing?
Good morning. I'm doing great. Thank you. It's awesome.
Thanks for being here. We love getting an update from your department as we do monthly, and that's what we'll kick things off here today.
Sure.
How are your medics doing, and what's the call volume been like with COVID?
So the medics are doing great. The call volume has been it's been picking up. We had that kind of a dip, in the middle of COVID where our run volume went down. But it seems to pick up. You and I talked prior to starting this morning on how busy it was yesterday. And today has been no change in that. So call volume's been picked up, and I think the thing that really has been kind of a little bit alarming is that the acuity has gone up as well. So a lot of the respiratory distress calls have turned into things that have been a little bit more serious. We've had some cardiac calls that have turned into things that have been serious. We've had a number of cardiac arrests over the last week or so, and I'm hoping that people understand that just because COVID is out there, that they need to call the ambulance if they're having some of those symptoms that deserve an ambulance: chest pain, shortness of breath. Don't be scared into thinking that just because there's COVID out there that you should stay at home and try to tough it out. Because I think if we went back and looked, we're finding that patients are waiting too long, and then by the time they do have to call us, they're already, kind of around the corner, so to speak, and it takes a lot to get them back. So, really, for if I had a message to anybody today, it would be call the ambulance if you need the ambulance, and go to the hospital and be checked out and let them do their thing before it's too late.
Yeah, that's very important stuff. It's actually something you had talked to us about earlier in the year. That there's definitely protocols in place at the hospital clinics to keep people safe. If you don't have COVID, you still can go in and be safe.
Right.
And same with you guys too. On the ambulance, you've got a lot of tools too to keep patients safe as you're going through call after call after call. Maybe talk a little bit about that, the safety protocols you have in place, which will lead into some stuff we're going to talk about here in just a minute.
Sure. So we have, since we've had another spike in COVID throughout the area, actually throughout the country, but especially throughout Wisconsin and Dane County, we initially had instructed or suggested to our providers that they wear a surgical mask on every call if it was respiratory in nature or an airway issue, that they switch to an N95. We've actually suggested to our staff that they just wear an N95 on every single call that they go out on. And we assume, whether there's symptoms or not, we assume that every patient that we come in contact with has COVID-19. So they're going to have the N95, goggles, gloves. We'll talk a few minutes about the PAPR that we've got on the ambulance. So that's a safety precaution as far as the provider is concerned. We will ask all of their patients to put a surgical mask on at a very minimum while we're transporting them if they can tolerate it. And without exception, they should be putting a mask on the patient as they go into the emergency room. The Meriter Hospital, I think all of the hospitals, Meriter and St. Mary's for sure, they have separate entrances for the ambulances. So if you go to Meriter and it's a respiratory patient, you may not go right through the main ER entrance. They have a respiratory entrance. It's kind of a back way into the ER. So we take patients into there so that we don't go through the emergency room. We're doing things like if we don't have to do a handheld neb, we try to not do a handheld neb. We have meter dose inhalers where the patient can breathe that in. It's a little bit better for them. That aerolized medication that we put out in the ambulance. Obviously, if we have to do it, we're going to, but we will stop that treatment as we go into the emergency room so we don't, aerolize the entire emergency room if somebody does have COVID. We're still spraying the ambulance. We've got a sprayer that sprays a substance in the back that takes care of COVID. And so when the call is over, the ambulance is thoroughly decontaminated. The front of the ambulance is decontaminated. We're wearing gowns, especially with respiratory patients. So we're doing everything we possibly can to make sure that we're not we're not getting it ourselves and taking it out into the community, and we're not giving it to the patient in the event that maybe we're asymptomatic. We're checking ourselves in the morning to make sure we're not have temperatures, and we're asking our employees to stay home if they're running a fever or a temperature, or they just don't feel well, to go get tested. I have test kits here that if an employee wants to come down and get tested because they feel that maybe they have the symptoms, and they can get the results back in 48 hours.
Yeah, it's good to know that the precautions, I mean, you and your team have, I mean, from the get-go, it's been pretty consistent on, safety is always a priority for certainly the medics and the patient. And I think it's good for people to hear that there's a lot of thought and planning into, going out the door. And there's a lot of things that go through a medic on a way to a call. But, when you're dealing with the pandemic, adding that stress on top of having to deal with everything else, I think it's great for people to hear that you're taking those precautions. Tell us about some of the new pieces of equipment that you got. And I don't quite know. What did you say? Is it PATS?
PAPR.
PAPR.
It's a personal. It's a purifying PAPR. So if you watch any of the news on TV or you see shots in the hospital where they have the hood over the top and it has an air purifier and they wear around their waist and it blows purified air, oxygen, or not oxygen, but air into the PAPR. We were able to, with the help of the town of Verona and some extra money that we had set aside, we were able to purchase 2 units for each of the frontline ambulances, and then the town of Verona was helped us out with purchasing 2 units for car 15 or 17. Essentially, Patrick and I, if we go out on calls, they're put on the ambulance. We haven't made it mandatory for them to wear the PAPR on all the calls. Some of our providers wear it on every call they go on. Some of them just put it on for those respiratory calls, and some of them just don't feel comfortable because it doesn't close your face. Talking with a patient out in the field, it's a little bit cumbersome because you have to talk a little bit louder, although it's not really loud with air rushing through there, but it is, you have to talk a little bit louder.
Oh, that's okay.
And
I was like, well,
we pride ourselves on being really professional and having good communication. And when you're talking to a patient through a big hood, it takes some of that personalized care that we all pride ourselves on doing. And so, but we're very grateful for the town of Verona that had some extra money that they got from the Safer grant and or the CARES grant, and so we've put those on the ambulances, and each of the providers have their own hood and stuff like that.
Yeah, does that, as far as keeping and reusing those products, how does that work with these? Are you having to treat it after every use? How does that break down?
The hoods are they're reusable. So once they're on, the staff can take like a cleaning cloth with some sanitizer on it and clean it, and then they can take the hood off. We've asked them to, if obviously gross decontamination or if it has a rip in it and things like that, they can throw it away, and we have more here, obviously. But for the most part, it's reusable for some patients.
Yeah, I think it's good information to hear as well, and it would be a little intimidating, as you said, with the patient care, talking through that device. But again, personal protective equipment for you and the patient, definitely top notch. Jeff, we're going to take a quick break. We're going to come back and we're going to talk about the ventilators here. So stay tuned with us. All right, we'll take a quick break. Be right back. You're watching Talking Fitchburg.